And the last item we have some time to cover is the patient is about traumatic urinary catheterization. The patient was admitted to the hospital for treatment of multiple injuries, and in the emergency room, the patient experienced a urethral injury as a result of an unsuccessful traumatic Foley catheter insertion. This resulted in bloody output from the urethra, and urology was consulted for this issue. In the final diagnostic statement, the provider listed traumatic Foley catheterization. How should this diagnosis be coded? And you realize that this is a very carefully crafted question. They've given us documentation of an injury, as well as telling us that we do have specific documentation that this injury occurs. And here, in this coding clinic, the answer is, in this case, the injury was a result of a procedure. Therefore, assign code 9975, urinary complications of a procedure, and 867.0, the specific nature of that urinary complication. In addition, the coding clinic tells us to use an E-code, E70.8, to identify that this was a misadventure to a patient during surgical and medical care. And while we might have many thoughts about this, the real answer to this coding clinic is this is what coding clinic tells us to do in this circumstance, and there's not a lot of wiggle room if you don't like that answer. Coding clinic goes on to point out that a traumatic catheterization would not be coded unless there is documentation of a specific complication or injury, which, as you noted in the question, was there. Coding clinic is telling us that if you don't have documentation of a specific traumatic injury, you need to query to make sure you have the appropriate information, where you will either be told, yes, it was traumatic and an injury, or no, it was not, and your coding decision would be based on that answer. Coding clinic goes on to tell us that, additionally, the bleeding would not be coded separately, since it is considered to be inherent in the injury. And whether you like that answer or not, it is what coding clinic says, and I point that out quickly because we've had prolonged debates with people as to whether bleeding is or is not necessarily inherent to a traumatic urethral catheterization. And again, in some respects, it doesn't matter what conclusion we reach. Coding clinic is telling us it is inherent and would therefore not be coded separately. Coding clinic goes on to tell us, and this is really one of the reasons that they bring this question to our attention, is that this is a different situation than was published in November-December 1985 coding clinic, page 15, where the patient pulled out their own catheter, and an injury code was assigned instead of a complication code because that injury was caused by the patient themselves and did not occur during the course of medical care. And that's really one of the reasons that this coding clinic is being brought to our attention, to bring about the difference in the nature of the occurrence of the traumatic urethral, the injury to the urethra. Okay? Next coding clinic on the very same topic goes on to point out patient admitted for treatment of rectosigmoid cancer. The fact that this is rectosigmoid cancer is really irrelevant to the question. So the patient's admitted for surgery. A Foley catheter is inserted prior to surgery. After surgery, the provider notes red blood cells in the urinalysis. There's no documentation of complication or an injury related to the catheter. What do you do about coding these red blood cells noted in the urine? And here the answer is, do not assign a complication code or injury code. Although red blood cells may be present in the urinalysis following the catheter insertion, this does not necessarily indicate a complication and or an injury, unless the physician specifically documents traumatic catheterization, as stated in the previous coding clinic, with a specific injury or complication. These red blood cells are not coded as a complication or traumatic urinary catheterization. Very important statement made by coding clinic. Don't go looking for complications where there are none. Yes, you could query for a clarification, but in fact, coding clinic doesn't require that in this circumstance. However, it does require it in the previous circumstance.